Now we're going to look at chronic pain. This is a condition that's estimated to cost the Irish economy up to €2.5 billion a year. But what exactly is it and what can be done for it? Well, I'm joined now by a world expert on pain, Professor Michael Cousins, who's over from Australia to speak at a pain conference in Dublin, and by Dr. Camillus, a pain expert from Tallaght Hospital. We'll be speaking to you both in a moment, and thanks for coming in. But first of all, we're going to take a quick look at a report that Aisling Riordan has made for us. She went out to visit one woman who has a daily battle with chronic pain.
Listening to meditation music while resting on her bed in the living room. It's one of the ways 54-year-old Bernie Shine tries to deal with her chronic pain. It all started 15 years ago, and since then her life has been turned upside down.
Well, my first memory of it, when it became a real problem, was around 1998. I had enrolled to go to art college at night, and I was working full time, and during those first few years I started to get headaches and then neck and shoulder pain, and I think, you know, the whole trying to do art college and work was very difficult, and I started to have physiotherapy, and I had MRIs and x-rays. I went to a doctor, but I wasn't getting anywhere. And eventually, I think in 2001, during a physiotherapy session, I remember my back, just something going in my back, and I was completely, you know, that really frightened me or scared me. And I tried to manage for a couple of months, and I was sleeping on the floor on duvets and stuff. And a friend of mine got me into actually Mount Carmel, and I saw a consultant, and I had an MRI, and they said that I had a ruptured disc. And eventually, I think it was a few days before Christmas, I had my first back operation.
Bernie has arthritis in her neck and shoulder, and following a second back operation, she says nerve damage has affected her foot, with medication not making much of a difference.
There's very little that medication can do for it. I mean, I am on a particular medication that works, you know, on the nerve pain and the nerve channels. It tries to block the pain. But I'm on them for 7 years, and I'm taking quite a heavy dose, you know, strong dose. And I know there's lots of other medication I could be on, but it's very important to me that I try and, you know, keep the amount of drugs I'm taking to an absolute minimum.
And what have you done to the house to make it a little bit easier for yourself?
Oh, well, you know, for the first, you know, in the beginning I was able to use the stairs, and as time went on, it just, the weakness in my foot, because I don't have the power, I started to find it really difficult to go upstairs, and I just stopped going upstairs, and I slept downstairs for a full year, until I finally, you know, decided, I said, what'll make this better? And I got a chairlift in, which again was a big psychological leap. I remember vividly the day it arrived, and my sister was with me, and I just felt kind of almost embarrassed, which seems a strange reaction, but I was kind of embarrassed that I was sitting on this chair, which you associate with older people. I have it now 4 years, I think.
And how do you manage to keep yourself sane?
Motivation can be difficult. You know, I did that writing course before Christmas, and that was one of the best things I ever did. I felt so empowered and excited, and I actually loved it. The teacher was brilliant, and it was organised through Chronic Pain Ireland alongside a group based in Tallaght, Art for Health, I think they're called. I had been in art college, as I said, but I had learned an awful lot, and I have an interest in photography and drawing and every kind of art, mixed media.
Bernie's hoping to make the Chronic Pain Conference, and says support is important.
A lot of us are hoping to go, and, you know, fingers crossed that I'll be there. And, you know, in my mind's eye, I will be there. So there's a lot to be said for support and, you know, it being recognised and getting the help, you know, that you need.
That report from Aisling Riordan. Well, Professor Michael Cousins, you are the keynote speaker at this pain conference. You're over from Australia. Thanks for coming in.
I'm delighted to be here too.
Well, that's good. That's good. Yeah. Listening to Bernie there, I mean, is that a fairly typical kind of
It's very
history?
typical. It's very typical. What you've heard there is somebody's life being gradually eroded, and that's a terrible thing to happen to a person. Can you possibly imagine having pain every day and every night? It doesn't take long. I've been in that situation myself.
Oh, you actually were a sufferer of chronic pain too?
I have for a whole year at one stage. And it doesn't matter how strong you are, it doesn't take too long to erode every facet of life.
And what can be done about it?
Well, the first thing that must be done is to destigmatise patients with chronic pain. They are stigmatised. People don't understand what they're suffering, why they're suffering, so they tend to treat them in a rather patronising manner. And that includes, I'm very sad to say, healthcare professionals. So that's the first thing that has to be done.
Well, it's seen as being in their head or something they just need to get over? Or...
Well, that's the other big progress that's been made. We now know for sure that chronic pain can become a chronic disease in its own right. And you might say, okay, well, that's fine, but where is the disease? The disease is in the central nervous system. That means largely the brain and the spinal cord. So there are actually anatomical changes, there are changes in the biochemistry, changes in the physiology. Why is that so? Well, it comes back to genetics. We all have a predisposition to certain conditions that starts at birth because of our genetics, but we now know that there's a subtle interaction between genetics and the environment that brings out what might start as a very low risk of chronic pain to be a high risk. But it still requires something else to trigger it off. Now, surgery was thought to be not a very big cause of chronic pain, but it now turns out that even a simple operation like a hernia, an inguinal hernia, has a 10% chance of persisting pain at 1 year. A mastectomy has at least a 20 to 30% chance. A thoracotomy about a 40% chance. Now, these are pretty high prevalences.
Very high. Is that new information? Is this something we've always known?
It's very new. It's been accumulating gradually over the last 10 years, but with the availability of brain imaging and other very sophisticated methods of investigation, we now know the mechanism. How does this condition occur? It has its own pathology, it has its own symptoms, it is a chronic disease. Now, that information is not out there. 90% of healthcare practitioners don't know that. So what chance have people got at the moment? This condition has no priority as an important healthcare condition.
Well, can I bring in Dr. Camillus Power here? You're working in Tallaght Hospital on this. I mean, to hear that, like, what is happening in Ireland for people who are suffering from chronic pain?
Well, in terms of the hospitals, there are pain clinics in most of the major hospitals, and there are people working hard to deal with this problem. But what we need is recognition. We need recognition so that we're part of health policy in the country, and there's a strategy. There's someone in charge. For example, we have a national clinical care programme at present, so the government has selected 33 conditions which are going to receive attention. Now, we're not one of those conditions, yet chronic pain affects 13% of the population.
13%?
The figure that you quoted there, 2.5 billion, actually in Professor Norman's paper, Prime Study, published in most prestigious journal in the world in terms of pain, it's called Pain, that estimated at 5 billion, so it's actually twice that. Across Europe, it's something like 300 billion.
That's the cost of chronic pain to the economy.
And that's looking at health, it's looking at the workplace, it's looking at insurance costs. Like, you can imagine a young person in their 20s, in their 30s, who they're out of action. Look at the figures for back pain. If you don't go back to work at 1 year, the probability of you ever going back to work is about 9%. Can you imagine the cost to the economy of that? This is a big issue that needs to be on the radar. And as Professor Cousins has just said, it's kind of not on the radar. This campaign has been running in Europe for 10 years now. So we're highlighting this as a theme because we amazingly have the EU presidency now. Well, not amazingly, we have the EU presidency. Isn't it an opportunity to lead in Europe as opposed to follow in Europe? We led with a smoking ban. So we're putting out a clarion call here to government, and we're saying we need to lead on this. It's important for the patient, it's important for the hospitals, it's important for the smart economy, interacting with the universities, interacting with industry, because we're on a good part of the learning curve in terms of neuroscience. We're getting new treatments all the time, new technology.
That is the next question. I mean, is there always something that can be done for somebody who is suffering from chronic pain?
Well, the one thing about chronic pain is the treatment is we offer a holistic treatment, and we're good at this in terms of we look at the biology, we look at the medication, we look at the technology, we look at the cutting edge of the technology, but we also have a very good rehab ethos. So we teach patients how to manage the pain. So even if the technology and the tablets don't work for them up to a point, we can teach people how to manage it. It's terrible to say to a patient, you must go and learn to live with it. How is someone who is sleep deprived, they got pain all the time, it's not accepted, they're in conflict with family, society, etc. How can they get their act together and learn to live with it? So we need to offer them some professional treatment so that they can learn to live with it.
Okay.
And we've got that capacity.
Okay, listen, thank you both very much for coming in, Professor Cousins and Dr. Power. It's a really interesting topic.
Pleasure.
And actually, we have had contact from Paula, who's been in touch with us by text. She says that she is in pain 24/7. She says it is an invisible disease which no one can see and no one understands, and therefore compassion is very thin on the ground. She says we're not work shy, drug-seeking people. Most of us want to be fixed. We want to come off our meds and contribute to society. Well, more research and training, she says, for doctors is greatly needed. Well, thanks, Paul, for getting in touch with us.
Can I make one comment in return to that?
Sure.
A lot of people do understand this now. They understand a lot about the chronic disease of chronic pain, and as a result of that, that's the whole focus of my research program. As a result of that, we're now identifying a whole lot of new targets to help attack the disease process that's acting in the central nervous system. So you do have a recognisable disease, you shouldn't be stigmatised, and progressively there's a great deal of hope for you to get good treatments for your pain.
Okay, well listen, thanks again, Professor Cousins.